This video is a brief overview of Step 2 of the Living with Risk Decision Support approach. The Living with Risk Decision Support approach was developed as a way to broaden our approach to risk assessment and management so that we can better support our older adults to live with risk. The Living with Risk Decision Support approach is a 4-step approach that supports a holistic, structured, and systematic review of an older adult's risk status. This training video provides a brief overview of Step 2. What is the older adult's risk status? But first, let's meet Sam. Sam is an 85-year-old bachelor referred for assessment of cognition, mood, decline in function, and safety by his out-of-province brother. Sam had lived with his sister since he was 65, but she passed away a few weeks prior to the referral. During the assessment, Sam was unshaven and wearing food-stained clothing. He was tearful and admitted to suicidal ideations. He stated that his appetite was poor, and his brother indicated that Sam had lost weight and that there was minimal food in the fridge. The house was dirty and run down, and his brother saw that there was many unpaid bills and stated that Sam could not find the will or manage the estate. Sam scored 15 out of 30 on the Montreal Cognitive Assessment. How would you rate Sam's risk status? Is this a low, medium, or high risk situation? What do we know about clinicians estimating risk status? The literature suggests that clinicians have a tendency to overestimate risk. Estimating risk can be highly subjective based on our own meanings of risk, and therefore it is possible that we attribute different weightings to risk. Clinicians assess risk over a continuum of low, medium, and high, where low is defined as comfort, safety, and independence, medium as concern and worry, and high as danger. The types of risk we are looking at often involve unquantifiable uncertainty, rather than risks for which there exists some quantified knowledge base. Lastly, the literature for risk and people living with dementia is sparse and varies. For instance, stage of dementia is not significantly associated with engagement in unsafe behaviors or number of accidents. There are not more accidents with living alone than living with a spouse, and perceptions of risk factors by carers and clinicians do not always correspond with actual quantified risks of adverse outcomes in the way that it was expected. How do you currently assess whether the risk is medium or high? Without a structured approach to estimating risk, we can easily underestimate or overestimate the risk. Assessing the level of risk typically consists of considering two factors. First, determine how likely it is that the safety concern will happen. Is it unlikely to happen? Are there risk factors that might increase their chances of the safety concern happening? If so, then rate the likelihood as moderately likely. Or are there risk factors suggesting that it's highly likely to happen? Next, ask how severe are the consequences. Based on the type of safety concern for this particular client, would you rate the consequences as minimal, moderate, or severe? Consider factors such as medical history and context to determine severity of negative consequences. Also, consider if the consequences are temporary or permanent. Clinicians rated the situation as higher risk when the consequences affected others. Determine your client's overall risk status by plotting the likelihood rating and severity rating from the previous decision tree into this matrix to determine if this is a low, medium, or high risk situation. There are additional factors, especially for medium and high risk situations, that might increase or decrease the person's risk status. For instance, how frequently is the safety concern happening? If it isn't happening frequently, this may reduce the overall level of risk. How imminent are the consequences of the concern? For instance, the consequences for malnutrition take longer to take effect versus the immediate effects of a fire or falls. If there's time to put into place recommendations to prevent the effects of the consequences, this might reduce the overall risk status. Does a person have reliable, consistent support in place? If they do, this could reduce the level of risk. Are there other concerns occurring? If there are, this might increase the level of risk. Let's look at the concern of malnutrition for Sam. Sam is at risk of malnutrition due to weight loss, decreased appetite, poor diet, possible low mood, and possible cognitive deficits. This is in the context of the fact that he is now living alone and his sister used to make the meals. Possible causes could be the cognitive impairment, which could be caused by a possible depression or grief. The consequences of potential malnutrition is worsening of his physical health if this is not addressed. Is this a low, medium, or high risk situation? The first question we ask is how likely is it that Sam is malnourished? Given that he has poor appetite, minimal food in fridge, has experienced weight loss, and his sister did all the cooking, we could say that he definitely has some risk factors for developing malnourishment. It is possible that you might rate Sam as being highly likely to develop malnourishment. However, given that his sister only died a few weeks ago, and Sam is willing to address this concern, it is possible that we can intervene before he would develop malnourishment, which is why we will rate the likelihood as moderate. The next question we ask is how severe are the consequences for malnutrition? Depending on the severity and length of malnourishment could have moderate to severe consequences. Given that this could be a new phenomenon for Sam rather than long-standing, we are rating this as a moderate level. In order to determine Sam's overall risk status, we input the likelihood rating and severity rating. We rated Sam's likelihood of developing malnourishment as moderately likely. And we rated the severity of the consequences of malnourishment for Sam as moderate. And so we could rate this as a medium risk for Sam. However, there are additional factors that might increase or decrease Sam's risk status. As malnourishment is a constant state, frequency is not applicable. But if he were to be malnourished, you might consider severity of the malnourishment. As the consequences of malnourishment take a long time to take effect, this could reduce the risk status. As he no longer has reliable, consistent support in place, that could have increased the risk rating. But as he was willing to accept some help, this reduces the level of risk. As there are other concerns occurring, this might increase the overall level of risk rating. And so we could rate this as a medium risk for Sam and decide if the additional factors either increase or decrease the rated medium level of risk status. We would then go back and do a risk status for all the other concerns we have for Sam before moving on to deciding how we can address the concerns.